save lives. We know that we're going to be living with COVID for some time, and the goal is to use this data to adapt to our new normal. So let's get started. Dr. Colfax, thank you and welcome. First of all, can you please provide us with an update of where we are in San Francisco as it relates to the numbers?
Yes, and thank you very much, Mayor, for your leadership during this unprecedented time and difficult time, and really supporting all of us as we move forward, focusing on the data, science, and facts. And Mayor, I have a presentation with a lot of data here that I'd like to go through, and obviously if there are insights or questions that you'd like to share during the presentation, please let me know. But I'll just give us a snapshot of where we are today, talk about what we can all do to bend the curve, reduce infections across San Francisco, and then talk a little bit about what the future may hold if we do not all do our part in terms of wearing face masks, practicing social distancing, and good hygiene. So can we go to the slide presentation, please? I think we need to go to the first slide, please. No, it's the first slide is number of cases in San Francisco. You're going in the right direction. Just go all the way back, please. Okay, so we got a little preview. So this is where we stand right now in San Francisco. And I'd just like to say that anybody can follow these data on a daily basis at our San Francisco, go to our data tracker at sf.gov, and you can follow these data to see where we stand. Where we stand today is we have nearly 4,600 cases of COVID-19 diagnosed in San Francisco. And I think it's important to also realize that nearly 1,000 cases have been diagnosed just in the last 2 weeks. So we continue to see high levels of diagnosis. And remember, the 2-week period is when people are infectious. So nearly 1,000 people diagnosed in the last 2 weeks. We've had 50 people die of COVID-19 related illnesses across our city. While any one death from COVID-19 is too many, a few pieces of promising data here is that our death rate is leveled off for a number of weeks. Our clinicians are doing a better job, better understanding using science on how to manage the disease. But unfortunately, this could change at any moment, especially if our healthcare systems get overwhelmed and people are not able to get the clinical medical attention that they need. Next slide. So there's a lot of information on this slide. And again, you can go to sf.gov to our data tracker and see this information. The big graph here with the jagged green line is the number of tests done in San Francisco over June and into July. And you can see those gray bars are the number of tests done every day. And I will say that we've exceeded our goal in San Francisco. We set a goal of doing 1,800 tests a day in San Francisco. For the last week, we have been averaging 2,600 tests a day in San Francisco. And you can see from that jagged green line, that's the positivity rate. So that's of all the people who are tested on that day, what is the positivity rate? And our positivity rate has been gradually increasing over time. It is now 3% over all time, but we've recently seen a large spike in the positivity rate, which is indicative of the virus spreading throughout the community. We can also see from the yellow bars here in terms of the cases, in terms of race, ethnicity, that we have a disproportionate number of people of color who are diagnosed with COVID-19 compared to the population in San Francisco overall. We see inequities with regard to the Latinx population accounting for nearly half of all diagnosed cases. We also see relatively large numbers in the Black African American community, and then also in the Asian community. This is why we're working with stakeholders across neighborhoods in the city, ensuring that community leadership and community leaders in neighborhoods, community members and their families are actively engaged in the response, know where to get tested, know where to get care, and very importantly, know where to access the other services needed during this very challenging time. Things like having access to food security, having access to behavioral health services, mental health services, and counseling, very important going forward. You can see here.
Dr. Colfax, do you mind if we take it back to talk specifically, because I want to clarify something. In San Francisco, we have about less than a 6% African American population, but we're seeing about 5.4% of the cases that are African American. So we don't see disproportionately the number of cases in the Black community like we do in other places throughout the country, but we clearly are seeing disproportionately the number of Latino community cases. And the question I have is, because that in comparison to any other race here in San Francisco, is where the biggest challenge is. And my question is, what are we as a city doing? What is the Department of Public Health doing in order to address this significant disparity?
Yeah, so thank you, Mayor. And we've been working from day one with regard to preparing and anticipating health inequities in this COVID-19 epidemic, largely because we know that the virus spreads in under conditions in which, unfortunately, we've seen in San Francisco that have affected health inequities for a long time. So with regard to the disproportionate impact in the Latinx community, we have been working with your task force, the Latino Task Force on COVID-19, to ensure that education, community engagement, that testing access is strong, and also that we are ensuring that when people do test positive, that they not only have access to the medical care, but as I said, the behavioral health support, the social services support, the food access, and not only that they have that, but their families have that. If people are not able to isolate and quarantine and do not feel that they're able to do that in their living situation, we are also ensuring that people have access to hotels as alternatives to their living condition, so they can isolate and quarantine safely and not put others at risk for transmitting the disease, acquiring the disease. We're also ensuring that with our contact tracing, which is such an important tool in this pandemic, that we have culturally appropriate contact tracing being done. Half of our contact tracing is being done in Spanish right now. We have culturally competent contact tracers engaging, and it's not just about ensuring that people feel comfortable telling us and talking to us about who they may have been in contact with and put at risk for disease, but we also really want to support the individual. Again, supporting the individual, linking them to those services. I also want to emphasize that as part of our work, we're ensuring that people get access to not only care for COVID-19, but medical care in general. And under no circumstances will people be identified by immigration status. And then this process is very confidential.
And Dr. Colfax, just to go back to some challenges around the inequities that exist with even our city's response. I mean, from day one, we operated an equity team through the Emergency Operations Center. But unfortunately, what we're seeing in San Francisco is a significant number of the people who are diagnosed with COVID-19 are mostly in the southeast, kind of the eastern part of the city, but the testing capacity is in the center of the city. And so we're seeing a disparity in terms of our testing capacity. So why haven't we done more other than the pop-up locations that we provided on a regular basis in various parts of the neighborhoods? Why have we not done more to have stationary locations to make it easier for people to access testing?
Yeah, so Mayor, from day one, when we started scaling up our testing centers, we established a testing center at Southeast Health Center. That was one of the first testing sites we had. We also established a testing site just outside of San Francisco Zuckerberg Hospital. So we have testing available there, as well as at the Mission Neighborhood Health Center. And we are also expanding our testing in those communities, particularly expanding testing sites in Sunnydale, Potrero Hill, and we've also just recently started testing at the hub in the Mission. So it's a key priority of ours to continue to ensure that people have access to testing, particularly if they are in the neighborhoods where we're seeing the highest prevalence of COVID-19.
Well, the good news is the one that was open in the Mission this weekend, they expected 100 people and they tested over 200 people. So we got to take the testing to where people are. And I want to turn it back over to you to finish up your presentation.
Absolutely. Thank you, Mayor. I think we have the slides coming. Yes. Yes, next slide, please. So the Mayor, you talked about the equity and COVID response. So I will reinforce that this slide emphasizes that we had our equity front and center of our COVID response from the beginning, and we're continuing to ensure that we're making continued investments through an equity lens as we move forward. Next slide. So I also wanted just to point out where San Francisco is relative to other communities that are dealing with this pandemic. This is looking at San Francisco compared to other cities and jurisdictions across the country. As you can see so far, our case rate is relatively low to other places. Our death rate is thankfully quite a bit lower at 5.8 per 100,000 people. And you can see compared to other jurisdictions, we are significantly lower than other places. And then our testing rate, while we continue to expand testing, our testing average rate is 2.92 tests per 1,000. And you can see that compares favorably to other places. Now, certainly we need to continue to expand testing. This is a regional, state, and national issue. There's lots of demand for testing now, and unfortunately there's delays in test results. But I would emphasize that here in San Francisco, our public health lab was one of the first labs to offer testing. We continue to expand that. And we're also working with our private providers, Kaiser, Sutter Health, Dignity, and others to ensure that low barrier testing is available to people. Next slide. So despite that promising news, we are in a very vulnerable situation. And the mayor spoke, Mayor, you spoke about our indicators right now. And this is the slide looking at our hospitalizations in the city from March into July. And you can see that our hospitalization rates are starting to increase. The dark blue bars are the number of patients in the intensive care unit over time. The light blue bars are the people in acute care, the medical surgical beds. They're not as sick as in the ICU, but they're sick enough to be in the hospital. And you can see that those numbers are starting to significantly increase. This is very concerning. We got up to a high of 94 in April in terms of our hospitalization rates. That was our first surge. We then, thanks to everybody in San Francisco, and we flattened the curve, and the curve actually went down. We actually crushed the curve, but now it's starting to go back up, and we are in another surge. We are unfortunately in another surge, and we expect to see these hospitalization numbers to continue to go up. The yellow bars in this graph also show the number of people in the hospital who have been transferred from other jurisdictions, because other jurisdictions are in serious trouble as well. Many of these include patients who are transferred from the outbreak in San Quentin. So again, we are in a surge, even taking into account those transfers. Next slide, please. So Mayor, you talked about our indicators. And this is one of our key indicators in the city. Again, people can go to sf.gov and see the indicators. This is the change in COVID hospitalizations by week. So this is looking at the change of number of people in the hospital with COVID-19, that rate of change. And as you can see, for a long period of time, we were doing really well in the city. We were in the green zone. That's those green dotted dots here. We were below the green zone, which was that increase was less than 10%. Then we saw a big jump a big jump consistent with the surge in the graph I just showed you. And we continue to be in that red zone with nearly a double rate of 20% compared to our target rate of 10%. So this is reflective of the surge, and this is why we made the very difficult decision to put reopenings on pause. Next slide. Similarly, we are seeing a big increase in the positivity rates of people who are testing. This is the number of cases diagnosed per 100,000 population over 7 days. And again, you can see we were in the yellow zone for a long time, and our goal here was to get to 1.8 per 100,000. We are now above 6 per 100,000. You can see that on the right. This slide is updated to July 11th, and we are at 7.8 per 100,000. So this again indicates that the virus is spreading throughout the city, particularly in the areas, Mayor Bree, that you mentioned, the southeast part of the city. Next slide. So this is a pretty complicated slide, so I'm going to just take a minute to describe it. So this is looking at the reproductive number of the virus. So what is the reproductive number of the virus? The reproductive number of the virus is how fast the virus is transmitting through the population. So a reproductive rate of 2 means that for every person infected with the virus, 2 people get infected with the virus. That's a very high transmission rate, very high transmission rate. A reproductive rate of 0.5, so half, means that for every 2 people infected with the virus, only one new person gets infected. So that's really good, because for every 2 people infected, only one new person gets infected. That means the virus is going down in the population. A reproductive rate of 1, which is shown here in the dotted line across this graph, means that for every 1 person infected with the virus, one more person is getting infected. So what we really want to do, ideally in a situation that we're in, is get that reproductive rate, that reproductive number below 1, which means that for every person infected with the virus, less than 1 other person is getting infected. That is so key. So what does this graph actually show? So these are scenarios that have been modeled by expert researchers at the University of California and UC Berkeley. They've been working with us since the beginning of the epidemic. And we asked them the question, given the data that we are handing to you to analyze in your models, what are the best estimates you have for the reproductive rate? And that is shown on the solid blue line here from April all the way through to July. So that solid blue line is the estimated reproductive rate of the virus across time. And we were doing so well in San Francisco, our reproductive rate got to below 1 and was as low as 0.85. So if that had stayed, the virus would have basically burned out in the city. Unfortunately, you can see here that starting in early June, we started to cross that 1. And right now, we estimate that reproductive rate of the virus is as high as is on average estimated to be 1.25, but could be even higher. That's what those blue fuzzy lines mean. Those blue fuzzy lines are estimates of the model. So the most likely scenario is that it's 1.25, but it could be even higher than that or even lower than that. But right now, our best estimate is that the reproductive rate is 1.25. Now that doesn't sound like that much difference, right? That's half a decimal point from where we were. So why is that such a big deal? Well, I'm going to go to this next slide, and I will tell you this is the slide that keeps me up at night. Next slide, please. So this is what happens if the reproductive rate stays at just that 1.25 number, just that 1.25 number with our current surge. That's what's creating our current surge. And you can see here that blue dark line, the most likely scenario, if everything stayed the same at 1.25 and there were no changes, we would hit a peak of 830 hospitalizations in our city. And let's think about that for a minute. In April, we peaked at 94. And thanks to all the work that people did in San Francisco, we sheltered in place, we drove that number down. It is now plausible, very plausible, that we hit hospitalizations at 830 if we do not do more to stop the spread. And those lighter blue peaks are plausible scenarios as well. So we could get as high as over 6,000 hospitalizations, a scenario that reflects the challenges that New York had. And certainly we hope that this doesn't happen, but it is so key here. We have a window to do better. Next slide. And again, another very concerning situation. This again relates to the reproductive rate of 1.25. So with that peak in hospitalizations, we will unfortunately have more people die. And we estimate that blue line, again, that solid blue line, that we could have as many, or we would average, 890 deaths from COVID-19 in 2020. We're at 50 right now. So by the end of the year, we could be at 890 with a reproductive rate of 1.25. And unfortunately, again, those light shaded blue lines show we could even get much higher scenarios, approaching 2,000 and even 3,000. So this is serious. We are at a very concerning time right now with this reproductive rate of 1.25. And we really need to drive down to 1 or below as quickly and as soon as possible. Next slide. But there is hope. And this is looking at as of July 4th, because we were looking at the July 4th weekend and asking everyone to do their part. If we could reduce that RE, that reproductive rate, by half, we would dramatically reduce our hospitalizations and our deaths. Look at that. We would go from those hundreds that we talked about to as few as 50 and 70. And even the scenarios that I showed you with those light blue shading areas, they estimate that our peak would be 120 hospitalizations and 120 deaths in 2020. So we can continue, we have an opportunity here, if we all do our part, to literally save lives and keep people out of the hospital. Similarly, even if we go for 2 more weeks and try to all do our part, again, we can make a difference, not quite as much. You see here that under this scenario where we wait for 2 weeks for the reproductive number to go below, to reduce by 50%, we still have peak hospitalization of 340 and an average of 230 deaths estimated in 2020. So the point here is time really, really makes a difference. Next slide. So key interventions to reducing RE, that's the reproductive rate. That's why we paused our reopening. And I know it's so challenging and difficult for everyone in this time of uncertainty. And this has real consequences, socioeconomic, personal, behavioral, mental health, and real health consequences as well. But we have to make the difficult decision that the benefits of doing this outweigh the very real risk. We'll continue, as we talked about earlier, further investing and supporting community leadership and response. Discouraging gatherings, especially inside, and I just want to emphasize right now that really please do not gather with people outside of your immediate household, and especially do not gather indoors. It is very dangerous to do that. Everyone, please wear face coverings. Please wear face coverings and socially distance and use hygiene. And I know that can be hard to do. It's hard for me to do sometimes, but please, it is literally saving lives. And then continuing to offer testing, expanding our testing, and contact tracing, such key tools to our efforts going forward. Next slide. So I alluded to this a little bit, but really riskiness of the activity. We know that outdoors is much safer than indoors. It's estimated that it's at this point, based on the latest data, that being outdoors is 10 to 20 times safer than being indoors, especially with regard to if people are not wearing face coverings. It's risky now to be involved in gatherings with people outside of the immediate household. And I want to emphasize that just because someone doesn't look sick or act sick or feel sick, they can still carry COVID-19. So you can't look at someone and assume, oh, this person doesn't look sick to me, or ask someone, are you sick or not? half the people with COVID-19 and who can transmit it can be asymptomatic at some point. That means they don't have any symptoms. The other piece I want to emphasize is testing. If you test and you're negative, you could still get COVID-19 right after that test. So don't use a negative COVID-19 test to decide if you're going to go hang out with your friends or other people outside of your immediate household. That is not a good test, because you could get it from those people, or you could contact it at some point and bring it back to an older relative in your household who's very high risk for disease. Face coverings, so important to be worn at all times. And we've put out lots of information about this and are continue to emphasize the importance of wearing face coverings. 6 feet of physical distancing continues to be key, and then hand hygiene. And then when we think about the activities, the number of people who are together, the more interaction that takes place, the more dangerous and risky the activity is. The frequency, the more people go out and interact, the more they are putting themselves and their loved ones at risk. The duration, the longer people spend time together, the more concerning it is for risk of transmission. And then the distance. This is why we are so focused on the social distancing and the importance of that, as well as facial coverings going forward. Next slide. And then I did want to talk a little bit about hope going forward, and just to emphasize that vaccines are being looked at and developed, and unfortunately, there's not likely to be any vaccine soon. So I don't want people to think, oh, well, I don't have to worry about this because there's going to be a vaccine around the corner. Key experts estimate it could be up to 12 to 18 months before a vaccine is widely available. That's different from saying, oh, we'll have a vaccine in 6 months or a year. That doesn't mean everybody is going to be able to get it right away, right? But I am proud that the health department and the city and Mayor Breed, that we will be testing vaccines across the city, including at the health department, at 25 Van Ness with our research unit, and then also at Zuckerberg San Francisco General Hospital. And we will be focusing on engaging communities most at risk for COVID-19 to support them in participating in vaccine trials that may start as soon as August. Thank you, Mayor, and that's my completed presentation.
Well, thank you, Dr. Colfax. I know we're at the end of our time here, but I do want to take this opportunity to just, kind of speak from a perspective of the people in San Francisco that are, of course, struggling. There are some people who financially their businesses are going under, people who are living paycheck to paycheck and have no paycheck coming in. I know that we have a lot of programs that we set up, but it still is very hard. And what happens in addition to the loss of your financial ability to take care of yourself and even your family, mental health becomes a whole nother issue. And in some ways, it feels as if, especially without our churches, our religious services, our ability to come together and congregate with one another, our spirituality, as well as the financial challenges that exist in the world, and our inability to socialize the way that we naturally do on a regular basis, it's almost as if we're trading one public health crisis for another. Because we know that, domestic violence has gone up, suicide rate has gone up, people are more depressed, people are more stressed out and trying to figure out what to do with their lives. We see, some of the violent crime that's going up in the city. How do we justify that? Because the fact is, you and I both know we are going to be living with COVID for the 12 to even 18 months or maybe even longer. And so this is hitting in various ways as we, try and keep people safe and try to prevent the surge in the hospitals and the deaths. But there's only so much that we can emotionally handle as human beings. So tell us how we're supposed to, deal with all of that. Yeah.
So Mayor, I appreciate that. And, again, this is just such a challenging time. I would say that the risk, the downsides to the shelter in place and the slow reopening are very real and very concerning, both from, as you said, an economic standpoint and a health standpoint. I think the counter to that is no jurisdiction that has said, okay, well, given those risks, we're going to go ahead and reopen quickly. As we're seeing across the country right now, the economic consequences, the mental health consequences of opening and having a surge. I mean, we've really struggled, and many people are struggling in San Francisco, but if we have a surge and get into a scenario like New York, or unfortunately like we're seeing in Houston right now and in parts of Florida, we would have all the concerns that you're talking about on top of the overwhelming the hospital system, the deaths due to COVID-19. We'd have all those things plus the COVID-19 pandemic profoundly affecting everything that we're managing and dealing with today. So certainly there are downsides to where we are right now, and the alternative, unfortunately, is even worse. And that's something that I think we just really want people to understand, that these times are hard, but having a massive pandemic in our city would make it that much worse. Mayor, if I could, I'd also like to give people a couple of numbers to, if they need behavioral health outreach, could I give them those numbers?
Sure.
So our mental health warm line is 1-855-845-7415. That's 855-845-7415. And then we also have mobile crisis. So for acute situations, our number is 415-970-4000. That's 415-970-4000. And the last thing is, if you see businesses that are violating the health orders around social distancing and good hygiene, please let us know. Please call 311. We will send inspectors out. And if people are violating those orders, we will take steps to be aggressively making sure that they do.
So I want to just also say, and just push back a little bit, because outdoor activities are permissible in a lot of instances with certain guidelines. And I do think that, for our religious services where people have the capacity to have outdoor services, or if there are ways that we can get creative with allowing other things to happen, because I know, again, your spirituality plays an important role in sometimes helping people through situations like this. So I do think it's going to be important for us, as we see the changes in the numbers, we want to provide people opportunities to deal with the challenges of what we're facing over the next 12 to 18 months at least. I mean, just think about what's going to happen with our kids and the schools and a number of other things. The fact that we have all of these playgrounds and kids can't even play in playgrounds. It is heartbreaking for me that we can't provide these opportunities. So I do want us to think about creative ways that we can support people. And if you are someone who is in need of help or support, whether it's mental health, whether it's financial help, whether it's just questions of where do you go and who do you reach out to, testing or what have you, call 311. We have a lot of city resources. We've developed a number of public-private partnerships to work with a number of community-based organizations to provide support. We know it's not going to be everything that you all want, but we are trying our very best to support folks who are struggling in San Francisco. And the sad reality is it's not just San Francisco, it's all over the country where we see this impacting our environment, we see it impacting our economy, our mental health, and the goal is to keep people safe, but we have to adjust to our new normal. Thank you, Dr. Colfax, for the opportunity to discuss this, and hopefully we'll be able to have more discussions in the future. And again, if anyone has questions or concerns, please reach out to us at 311. Thank you, everyone.
Thank you, Mayor.